Hello and welcome again. Welcome with me live from Pakistan, Dr. Sara Khurram. She is a health innovator and she has established one of the most amazing telemedicine platforms for female doctors. She is a pioneer in telehealth medicine, and Sara will tell you about her journey through the telemedicine platform in Pakistan. She will talk about female doctors. She will also talk about the ratio between patients and doctors in Pakistan. And she is an award-winning entrepreneur from Pakistan. Welcome with me live from Karachi, Dr. Sara Khurram. The floor is yours, Sara.
Thank you so much, Petra. It is an honor to be here today. And thank you for doing a great job in getting this together. It is an extremely needed platform today. And we are very, very happy to be a part of this. So hello, everyone. My name is Dr. Sara Saeed Khurram, and I am a social entrepreneur from Pakistan. And I run a company called Sehat Kahani. So Sehat means health in Urdu, and Kahani means story. And as the name suggests, we're trying to change the way health stories are written in Pakistan. And my story starts when I was a little girl. So when I was around 5 years old, and if you can see the picture on the screen, that is actually me in the picture when I was 3 years old. My mother, even at that time, used to tell me that you can do anything in life if you can become a female doctor. And uh, and from my 5 years of life to all the way to my college to my university, I have heard this sentence again and again. And there is a reason why middle class families in Pakistan who have some money to educate their daughters, they say this sentence to their female daughters again and again. Because being a female doctor in my country is an act of nobility and gives you a high social stature. Ultimately, it gives you the best hand in marriage. And this has a term, it's called Dr. Brides. So I entered into a medical college when I was around 16 to 17 years old. And what I saw in my university is that there were other 80% females as well. And as we graduated from our first year to our final year in the medical college, the women that I saw were very ambitious to get that medical degree. I suddenly saw them getting married and having children. And suddenly, this idea of Dr. Brides became very, very real to me. But when I also did and this showed me to a new reality that Pakistan has around 200,000 doctors. Out of which 60% are female doctors. But unfortunately, as many become doctor brides, only 1 out of 4 of these doctors enter into formal practice, which means we have one doctor for 1,700 people in the country, which is a huge mismatch, even according to the minimum WHO standards, which is one doctor for 1,000 people. So I also became a female doctor. I graduated and I started doing my house job, which is an internship of 1 year that you do after your graduation. And when I started working in a tertiary care hospital in the biggest cities of Pakistan, I realized how it affects the population of the country that I live in. So Pakistan has around 100 has a population of 200 million people, out of which 100 million people, 50% of our country, never gets to see a doctor in their lifetime, which means that we are ranked 154th out of 195 countries in terms of accessibility to healthcare. And a huge issue why healthcare does not reach our communities is because the majority of the medical workforce does not end up working. I was in the gynecological ward in the biggest hospital in the country. And one day we got a patient who came from 7 hours distance from a village to the city. The lady was 7 months pregnant. She was septic. She was febrile. We took her to the OT. We started the C-section. And within 60 seconds, the patient died. And the OT was filled with green pus. The patient did not know that she was pregnant with twins that had died a month ago, just because she could not see a doctor in a low income community where she belonged. Um, As I move forward from my job, I also got married and I had a newborn daughter, and because of that I couldn't work for a while. And the only thing that saved me when I could not work and I became a doctor bride was that there was a clinic that I used to work in during my pregnancy, and I started giving on-call consultations in that clinic to see patients. And that clicked into an idea that if I, a female doctor sitting at home, can provide consultations to patients on a phone call, why can't this big majority of female doctors who become doctor brides and don't work, why can't we connect them to patients whom healthcare don't reach using an audio video solution? And that's exactly what Sehat Kahani does today. So what Sehat Kahani does is we connect a large pool of female doctors to patients who need healthcare using a telemedicine based solution. We do it in two ways, and we do it because Pakistan is also a population where 85 million people have access to smartphones today, and there is 36% internet penetration. So we take this power of technology and connect the supply and demand gap using two solutions. For low income communities where patients still prefer traditional methods of care, we upgrade traditional clinics into telemedicine clinics. We partner with nurses already working in these clinics. We train them for telemedicine. We upgrade the infrastructure, and we connect the patient coming to them to an online doctor who can be placed anywhere in the world. For the urban market, for smartphone users in Pakistan, because that's a growing population, we have a mobile version of our application that allows a patient to connect to a doctor independently within 60 seconds and in 2 clicks to an online doctor instantly. We provide this platform in our urban user market to individual users as well as corporate consumers through corporate channels. Within our clinics, there is a nurse who guides the patient to get the online consultation. So when a patient walks in, the nurse takes the history and examination, and the nurse connects the patient to an online doctor. After the consultation, the prescription is given to the patient, which is printed at the clinic, and the patient can also access various value-added services, for example, drips, injections, a weekly ultrasound service, and a weekly lab service that are available in the clinic for them. So that becomes a one-stop shop in that low-income community. On the mobile application, if the patient is downloading the app themselves, the journey becomes a little different. So the patient can download the app, they can connect to the female doctor instantly within 60 seconds through a consult me button. And within 2 clicks, you connect to a doctor and talk to the doctor, whether it's 12 a.m. in the night or 4 o'clock in the morning. After the consultation, you get a prescription that comes in your mobile phone as well. Sehat Kahani, within the last 4 years of its growth, has created a network of 5,000 female doctors all over the world. These are all Pakistan Medical and Dental Council verified doctors who pass through a learning management system to provide the best quality of healthcare to the Pakistani citizens. These doctors work with children, they work out of their homes, they can be in their place of comfort, but they provide healthcare only using a smartphone or a tablet or a laptop. We pride ourselves to be an impact business as well. So we earn money from whatever stream we have. In the clinics, we charge $1 to $3 for a range of services. Our mobile application services in the corporates as well as retail are also charged through subscription plans and fee per user. In the last 4 years, Sehat Kahani has created a network of 32 clinics across Pakistan in 3 out of 4 provinces. We work with 51 corporate partners as a corporate user base to provide healthcare to their employees. And in totality, we have created around 340,000 consultations through telemedicine for patients in the country and overall impacted 3.1 million lives. We've also created steady revenue to sustain ourselves and grow further. When COVID came in Pakistan, our company and the whole country was a very interesting situation. Because Pakistan is a country that likes physical touch and physical healthcare. But we were stuck in a situation when the country went in a lockdown. Our primary source of work till that time were the clinics, and our app was really new. So we had a 3-month-old app in the market, and we were trying to get a market to use it at that time. But when COVID happened, our app market went up. So from 18,000 downloads, we went to around 140,000 downloads. And from 18,000 consultations, we went to 120,000 consultations within a year. From 8 corporates using our service, we now have 51 corporates who use our network for all their employees. And very interestingly, 5% of our consultations since last year has happened for Pakistani diaspora outside Pakistan who rely on our services to get quality healthcare through our female doctors. Our network of clinics expanded from 27 to 32 clinics, and now we're opening 13 more within the next 6 months. And also in the fourth province that we're going to enter this year, which is the most health impoverished province of Pakistan called Balochistan. We are the largest corporate telemedicine provider in the country. We work with insurance companies, we work with banks, we work with multinationals to cover their employees and their consumers through our app. Not only this, we integrate our app into third-party applications such as banking apps, ride-hailing apps to make sure that their customers can also access our services through health solution through a white-labeled option. The biggest achievement that I believe that we have been able to create in Pakistan is to work with the government to make sure that this is taken up at a government level. So in COVID-19, Sehat Kahani was a primary telemedicine partner working with the federal and provincial government, providing free of cost consultations to patients who needed at-home consultations. We also partnered with the Pakistan Medical Council to create a regulation for the first time on telemedicine. And we also have various academia partners who help us ensure our quality practices are up to the mark. Along with this, we did two very interesting projects in last year. So our applications are used for people who have smartphones or people who come to the clinics. But there is a huge population in the country who do not access both. So we created a helpline, a feature-full helpline for patients who can't access our clinics and our mobile application through a phone number, where a patient calls in and the nurse connects the patient to a doctor on call 24/7. We also used our mobile application through a government-led project in ICUs across Pakistan to connect junior doctors within ICUs to critical care specialists to provide critical care to patients within ICUs. Just for the context, Pakistan has only 70 to 80 critical care specialists for 200 million people. So this multi-stakeholder government project helped almost 1,000 patients till now to get critical care in the ICUs. If I talk about our medical diagnostics, so 8% of our consultations has been for COVID-19. We have made sure that we provide primary level as well as secondary level care in our clinics. Along with this, as we are a social impact-based business, we have raised 2.1 million funding, which is equity as well as grant-based over the last 4 years. We have been mentioned in a series of publications and documentaries, the most recent being The Economist, for mentioning our work to be something worthy of mention in COVID-19 in a tertiary care, in a third world country such as Pakistan. From a medical doctor who once was in a home with a baby, not knowing what to do, I now run a company of 200 plus people in Pakistan who work in 3 provinces through a headquarter as well as a regional team. We have created a revenue of 600,000 till date, and we're aiming to create a revenue of $7.2 million in the next 5 years and provide healthcare to 4.5 million people in the next 10 years as a 5-year plan. As for myself, I think there was a point in my life where I thought I would never go back to work again. From that point, I think I now work more than 18 hours a day. I did my master's in health policy and management, along with having a second child and running this company full time. I was able to represent Pakistan at many national and international levels to make sure that wherever I go, they see a progressive woman from our country representing the value of what women can provide in our communities. I think I've realized that many women in my country believe that their love can only be for their husband or their children. But what I've proved in my journey of the last 4 years is that your work can also be your love, it can be your passion, and it can be as important as your family and your children. If you do feel strongly about something that emotionally and physically and mentally connects you to your mission. Sehat Kahani wishes to empower 50,000 female doctors across Pakistan to make sure that these female doctors can provide consultations to patients not only within Pakistan, but also outside Pakistan as well. I truly believe that we can impact 25 million lives in the next 10 years using our model. And this service that we've created within Pakistan can be expanded to a lot more areas and regions in the world where healthcare access is still a dream. I believe in the power of females connecting a new world together through technology. So that's my story of being a female doctor in Pakistan and revolutionizing healthcare for everyone. Thank you.
Wow. Sara, this is an incredible story. What a role model. I really have to say, this is just amazing what you have done. Also, you have already mentioned it. I really want to know from you, when you started, just I'm pretty sure there were tons of people saying this is not going to work. You will not succeed. I'm really, and I think all the audience as well is really interested. Tell us how you started and which obstacles you were confronted with.
So it's very interesting when I started, and we initially had this concept that female doctors sitting at home can provide consultations to patients. When I took it to a lot of people, so initially we were trying to find a chain of clinics that we can upgrade into telemedicine clinic, from NGOs to government to friends and family to my own family. They all thought that it would not work, and that I am still continuing with my postpartum depression and I have not fully recovered. It was an alien idea. It was very hard to convince people around me that I don't want to be a clinician and I want to turn into a social entrepreneur, as I do come from a very traditional family where it's difficult for women to work after marriage, let alone run their own business that requires a lot of time. But I've always believed to hear my heart and to do what my heart tells me to. So I carried on. I knocked one door after the other. It took me 6 months to find one clinic to pilot my services. And that also a kind gentleman, when he gave it to me, he said, if you can't run the clinic for more than 1 year, I will take it back. And I took that one clinic, and then the journey did not stop. When we made a chain of clinics, me and my co-founder thought that why only provide healthcare in Pakistan to people in the low-income communities and not to all through a smartphone app as well. And believe me, even after running a social enterprise for 2 years, when I mentioned it to people, people told me that you are a doctor, you're running a social company, that's fine. Why do you have to get into a tech commercial business now? But me and my co-founder believe that the most that can happen to us in the journey is that we can fail, but we need to try. And we tried it, and COVID happened, and our app got a boost as well. So I believe that the only thing that has worked for me is to work with passion, is to actually be in love with what I've created, to be able to do it again and again. And even if we fail, just start up again and do it again.
This
And
is
I think
just
that has been the
amazing.
secret to our success.
No, this is just amazing. And I think everyone who's actually listening feels your power and your energy and how you love your baby. And it's really, really super exciting. Sara, do you believe, because actually you're focusing on female health and you started this with a female doctor force, do you believe that the whole telemedicine, that they can fill the gap, the huge gap actually we have at the ratio doctor and patients in third world countries like Pakistan? Do you think that there are also other applications that you can bring it to another level? Telemedicine platform?
Absolutely. I think what I do feel is a secret sauce to our application is it's not just an application. It's an application with a network of doctors backing it. And that's where you get two solutions in one. I think the biggest success factor for the application has been that we connect the patient to a doctor within 60 seconds to an available doctor. They don't have to book an appointment. They don't have to wait for the next day. For someone in emergency who needs healthcare there and then, that's the key that works for them. I believe a doctor has no gender. It can be a male or a female. I think the biggest difference what a doctor creates in your life is the quality of care. When they listen to you, when they take a history, when they make sure that the issues are consulted for and you get the right medicine at the right time. If we are creating a female doctor base that is able to do that instantly for patients and able to follow up as well, I believe that this service, along with this network of doctors and our application, can be replicated in any country where there's a similar health access issue.
This is just absolutely amazing, Sara. Again, I think your story and what you have achieved in basically also no time with your energy and your enthusiasm. I'm really totally impressed. And we are very, very happy that you were here today. And we, of course, invite you to also join the Davos Digital Forum big September edition, where we have you then again. And hopefully you will be in Davos, live from Davos. Dr. Sara Khurram, thank you so much from Karachi live. Have a good time, have a good year. And we are looking forward to welcoming you again. And to all the others, please stay with us. At 10:15, we have Dr. Garif Yalak from Cisco, who is talking about technology and healthcare. Sara, again, thank you very, very much.
Thank you, Petra. It was an honor and privilege to represent my work and a story from Pakistan at this forum. Thank you so much for inviting me, and looking forward to reconnect again. Thank you.
Thank you. Bye, Sara. Bye.
Bye. Bye, everyone.